PowerPoint, so I think that I'll talk from my seat here, if that's okay, and then it'll lead to the question and answer period. I'm Kevin Casey from Harvard University. I've been with Harvard for over 20 years and have actually followed an actual example of how data and how it intersects with public policy can become a complex, controversial, and difficult set of issues for not only the researchers, for the participants in the studies, for policymakers and politicians, but for me, actually, for 20 years. So I think that that's why I'm here. I'm going to read something that is actually familiar to all of you, but I think it's at the core of part of 20 years of my work, and that is the disclosure that was signed by the participants through the 70s and 80s who participated in the original Six Cities study that Doug Dockery and others at the Harvard School of Public Health enrolled to begin work that has continued to be built upon for 20 years. And it said, Harvard University School of Public Health hereby gives the assurance that your identity and your relationship to any information obtained by reason of your participation in this study of respiratory symptoms will be kept confidential and will not otherwise be disclosed except as specifically authorized by you. I know we've talked about informed consent and disclosures and the fact that some people may not be aware of how their information would be used when they provide their consent. In this instance, what they were sure of is that it would be private and that they would be in the hands of Harvard University. And I think that that's a particularly important factor as we look forward and as we take a snapshot of that time and look forward over 20 years, and the way that it intersects with the public policy, because this is it seems to me, a unique set of data that comes together in a complicated fashion that implicates privacy and also undermines some of the broader public understanding and confounds politicians and policymakers. And it's a conundrum that we need to sort of figure out, which is why I was pleased to be asked to come here and talk about it, because we would all like to get to the bottom of a way to go forward. What you may not all understand is that there are three sets of data that have been involved in these AIR studies, and they involve the individuals and their histories and what happens to them with their respiratory systems when they're admitted to hospitals and that, and the location of where they are. And that's different than other kinds of biological issues where if someone's eating broccoli, you don't care where they're actually located. You're wondering about how it affects their health, whether they're in France, Cambridge, or California. In this instance, it's important to know where they are because it intersects with the air quality data at that time when they might be admitted. And then there are death records. And this combination of three sets of data makes the work compelling in terms of policymakers who are interested in knowing what air standards should be. And it also makes it precious in terms of the care that needs to be taken to protect the subjects. Because if you know what the air quality is at a particular time, and you know when somebody died on a particular date, and you know the town where they were located in, it isn't very hard. You don't have to go to the earlier slide deck that we saw. 2 people died in Watertown on July 2nd, 1997. One's a woman, one's a man. We actually know who it is. We provide that data. It violates exactly what we have provided when these people enrolled. Secondly, the death index data itself has a disclosure that we sign that says something very similar, that we will not allow it to be used in a way that will disclose any individuals who are a part of that work. So that's kind of foundational information to know about this clean air work, which might be different than some of the other HIPAA and other applications. But in this instance, when it applies to the Clean Air Act, and the Clean Air Act states that it should be revised periodically, and when it is, it should draw upon the published research that's available. And when they do, it has directed attention to the Harvard School of Public Health commonly, and our work percolates, bubbles back up. And this interplay between our inability to provide enough information to certain policymakers to make them feel like they have all of the data to support the determinations of EPA and others on clean air standards, and protecting the confidentiality of those who are enrolled comes into play. And it is a major issue because the whole concept of enrolling people in studies is at risk. I believe the response is different if you ask somebody from, say, a medical doctor from Johns Hopkins University asking someone to enroll in a longitudinal study, if they say that we will provide you with the assurances that I read earlier, or you add to that, and we will give it to the United States Congress and other people to utilize as they would like. I think that it would have a chilling impact, and it's not to cast aspersions on the Congress or others. It is an actual conundrum that we are facing. The issues that are raised by members on the Hill who are asking about this are legitimate. There is kind of a donut hole here that is built in to the work that's being done, and we have been unable, to their satisfaction, to provide them with every single kind of document that they would want. The reasonable thinking people who are serious about clean air, who are serious about solid policy, who want the federal government's work to be valid, those people have reasonable questions that they're raising. We would like to get to the bottom of them also. Our researchers are not trying to hide the ball. Some of them have been working for 20 years and have not gone to a meeting where they haven't been confronted with this issue. If there were a way that they could thread that needle and provide the amount of information to satisfy reasonable policymakers in the pledge that they made to their subjects, they would do it tomorrow.